Everyone. Am I audible? Someone please confirm. Am I audible?
Yes, you are audible.
Good afternoon, everyone. Let's start our today's session. Uh, on the behalf of CDFA Visual Club, I welcome to all of you on this insightful session on critical parameters impacting embryo recovery performance in males. We had um, our guest speaker, Dr. Maria.
Yes, I'm here.
Maria
Let
has
me open the camera. Sorry.
Maria has veterinary degree from Brazil in 2013. She has also a vast experience in the equine reproduction, artificial insemination, and embryo uh, production. She also has a privilege to work with the China in the Jockey Club. She continuously participating in international conferences. Also, she is working as German Standard Group. Mm, the mic is over to you, Dr. Maria.
Hi, how are you?
Fine.
So, okay, let me organize it here to start. Is everybody ready? Can I start sharing the screen?
Yes.
Okay. All right. Is everybody seeing the screen?
Yes, we can
Is it
see.
in the presentation mode or it is as the PowerPoint?
Not yet. I think it is in the PowerPoint.
Okay, let me see here. Let me start again. Mhm, mhm. Entire screen. Let me open here. And then I open presentation. Maybe now. I think now it's working, right?
Yes, it is.
All right, perfect. So, well, good afternoon to everybody. I hope everybody is doing well. And today we are here to talk a little bit about the critical parameters impacting embryo recovery performance in mares in embryo transfer programs. So to start, I would like to share with you some data of papers published around the world. And here we have the day of the flush around the day 8. We can flush mares between day 7 and 9 usually, but the more common it's on day 8. And we can see here the pregnancy rates, no, sorry, the recovery rate of this first one around 74%. In this other one, 52% of a recovery rate. Here in 2019, 72. And this one, it was performed in Pakistan and achieving 70% of embryo recovery rate. And that what are the most common factors that are affecting the embryo recovery uh, in wait, just let me close this one. The Marshall told me, okay. Sorry, just managing the screen here. Uh, well, so what are the most common factors that are affecting embryo recovery in embryo transfer program? To start, I would like to highlight that the embryo program is like a big puzzle where we have a lot of pieces to manage, and we are trying to play with them in the best way as we can. And one of the most common factor that is affecting the embryo recovery is the donor age. So we know that as older is the mare, as lower is our embryo recovery. As we can see here in this paper, they achieve about 57% of embryo recovery when working with donor mares with less than 15 years. And when working with donor mares with more than 15 years, they achieved 39% of embryo recovery. In this other paper, they split the mares in three categories. The first one between 2 to 8 years, achieving 61% of embryo recovery. In the second one, mares between 9 and 17 with 51% of embryo recovery. And in the last one, mares between 18 to 28, achieving 30% of embryo recovery. So it is harder to us to get an embryo from older mares, but these embryos, it will also impact the pregnancy rate in the recipients. So usually the pregnancy rates are lower as well. The infertility history, of course, if a mare has any kind of infertility, it will affect the embryo recovery. As we can see, that healthy donor mares have a huge, significant influence on the success of the embryo transfer. So, what are the most common factors that are related to infertility in mares? We have a cervical incompetence, when the cervix cannot open properly, sometimes due to fibrosis. Some oviductal obstruction can happen as well. Endometritis, that this is the most common infertility issue that we will face in embryo transfer. Irregular cyclicity, metabolic diseases can also affect the fertility of the mares, and the chronic disease as laminitis, it will also decrease the recovery rate. Of course, we can create a situation of infertility, or we can make the situation even worse. As here we can see that the perineum of the mare is a very contaminated area that even after cleaning, we still can see that some feces go inside. And believe me, the bacteria are here. So if we don't do a proper cleaning of these mares, we can carry a contamination inside the uterus. So it is our job to clean these mares properly every time before going inside the uterus. It can be for the insemination, it can be for the flushing of these mares, or it can be for the embryo transfer. So we must take a lot of care while we are cleaning the mares. The day of the flush, it will also have an influence in the embryo recovery. Sometimes when we have to flush these mares too early, the embryo might not be there, so we will not be able to recover. As we can see here, the embryo recovery flushing mares between day 7 and 9 were about 74% and 81% of embryo recovery. And when flushing mares on day 6, it decreased for 62. In this other one, flushing mares between 7 and 9, they achieved since 66% until 56% until 66% of embryo recovery. And again, flushing on day 6, they had a lower embryo recovery. Usually, the embryo should enter in the uterus about day 6 or day 6.5 post-ovulation. However, not always we know the exactly time of the ovulation. So these, sometimes we think that we are flushing mares on day 6, but they might be like 5.5, and this embryo might not be there yet. And some mares, they will have a delay in the embryo development, so it will take a little bit more time to these embryos to get inside the uterus. Also, the flushing technique. When we don't have a lot of experience flushing the mares, we might not do a proper procedure. So when we are investigating our embryo recovery, if it is too low, this is something that we have to think about. It is important to have the uterus completely full of fluid, so but not overflow, because otherwise we can have some efflux of this fluid into the vagina. And we have to take care to not leave a lot of empty these uterus as well. So because of this, when we are doing the procedure, we are always checking the mare by transrectal palpation to be sure that all the uterus is full. Otherwise, if it's not full, we will not recover this embryo if it sometimes it is in the tip of one of the horns. Also, the quantity of air that we inflate the cuff, sometimes if we are using a lot of air, can make it a little bit more difficult to recover the fluid. So we just have to release a little bit of air and keep flushing the mare. Regarding the stallion and semen quality, we know that there are some stallions that they are more fertile than the others. And some of this fertility is related to the sperm cell itself. Like if we have DNA fragmentation, for example, we will have a much lower pregnancy rate or embryo recovery, and we can also have a much higher pregnancy losses if the stallions has any kind of mitochondrial issue in the sperm cell or chromosomal problems as well. So these are things that we cannot fix it because it is intrinsic of the stallion. But if we have a stallion with a good morphology, with good motility, but we don't know how to work properly with the semen, then we can create a issue with the semen quality if we are not cleaning the penis, if we don't do the proper dilution of the semen, or if we don't freeze properly. So this will affect the quality of the semen and also our embryo recovery. As a lot of papers are showing and saying to us that embryo recovery has been used as a diagnostic tool to evaluate the fertility of the stallions. So the quality of the semen, it will influence our embryo recovery. In this paper here, they had two different categories of semen. One were classified with average quality semen, and the other one were classified as high quality semen. And they split in these two categories based on all these parameters that they evaluate. And the recovery rate for semen classified as high quality, they achieve 63% of embryo recovery, and using an average quality semen, only 48% of embryo recovery. Also, the type of the semen. Using fresh or cooled semen, they achieve similar embryo recovery, around the 51%. And when using frozen semen, they had 33% of embryo recovery. In this other one here, using fresh semen, 60% of embryo recovery or pregnancy rate. And in this other one, using cooled or frozen semen, they achieve similar pregnancy rates, around the 44 and 46%. So it's not totally related to the type of the semen, like if it is fresh or cooled, but it is related to the quality. So if we have a very good quality semen, frozen, fresh, or cooled, we will have a very good pregnancy rate or embryo recovery. The insemination volume. When we are using the same amount of sperm, like here in the first experiment, they use 100 million motile sperm per insemination. And here in the second experiment 200 million motile sperm. In different volumes, in 10, 100, and 200 mLs, they see that there are a difference between the pregnancy, the embryo recover. So using the same amount of stallion diluted in 10 mLs, they achieve 40% of pregnancy of embryo recover. And in the second one, using 250 millions, 70% of embryo recover. Using 100 mLs, they achieve 10% or 13% of embryo recover. And they using 200 out of 8 flushes, none embryo were recovered. Here, they say that there is no statistical difference between 40 and 10, but if I am flushing 10 mares and if I recover 4 embryos or 1 embryo in my routine, this is a huge difference. In this other one, as the same idea, using 250 motile sperm, in 10 mLs, they achieve 70% of embryo recover, and diluted in 50 mLs, they achieve 35% of embryo recover. So when we are using a lot of volume for the mares, we are creating a more a little bit more trouble for this mare to clean herself and to be prepared to receive this embryo in a so short time. If the mares have multiple ovulations, so if the mares can have double ovulations, it will increase our chances to have at least one embryo. As we can see here, when the mares had a single ovulation, they had 64% of positive flushes, recovering out of 533 embryos out of 821 flushes. When the mares had the double ovulations, they had a higher quantity of positive flushes of 76%. Sorry. The interovulatory interval. Usually, when we are working with donor mares, we will also use prostaglandin to decrease the length of the cycle, so making them to cycle faster. Then we are able to flush these mares faster. However, we have to pay attention that when these mares have a very short time, it will have an influence in our embryo recovery. In this paper here, they have the first group were not used the prostaglandin, and they achieved 73% of pregnancy rate or embryo recovery. In these other 3 groups, they used the prostaglandin, and they evaluate the influence of the interval between the treatment and the next ovulation. The interval 4 and 7 between the treatment and the next ovulation, they had only 46% of pregnancy rate. When the mares had an interval between 8 and 10 days, increased for 64. And when the mares had an interval with 11 or more days, it increased for 71% of pregnancy rate or embryo recovery. So when we make this cycle too short, it will decrease our chances to recover an embryo. So eventually it's better to not give a prostaglandin or to delay 1 or 2 days and give more time to this donor to recover her uterus from the flush, to have more days of endometrial edema that we know that is important to the embryo survival, and also to avoid here in this time to catch that follicles that are from a secondary major wave. The full heat. Some owners will want to use the full heat for the flushes, but what we see that sometimes this is not the best heat to breed the mares. As we can see here, out of 23 mares, they recover 48% of the embryos. And in the control mares that were not postpartum, out of 14, they achieve 71% of embryo recovery. They also evaluate the size of the embryos. So in the postpartum mares, the embryos were smaller when compared in the control group. So eventually, if the owner wants to use the full heat, we can explain to him that our chances to recover an embryo is lower, so it's better to wait another for the next heat. Otherwise, we will lose that flush. In this one, they split the mares, the postpartum mares, in 4 different categories, so that the mares that have ovulation between 7 and 10 days after the foaling, and they had a lower pregnancy rate, about 67%, and a much higher pregnancy loss. Mares that had ovulation between 11 and 20 days, they achieve 69 and 72% of pregnancy rate, and much lower pregnancy losses. And when the mares had more than 20 days between the foaling and the ovulation, they achieve a much higher pregnancy rate of 80% and around 90% of pregnancy loss. So it's really more interesting to wait for these mares than using the first full heat and don't have them in full or don't have any embryo. The seasonality. Here in Emirates, we are working against the physiological breeding season of the mares. So we are working during fall, winter, and the springer time. And when we are working during transitional, we will have less ovulations and the more ovulations failures. As you can see, this paper were produced in Egypt. And here is the percentage of corpus luteum that during the summertime, the mares have much more ovulations when compared with the winter time. So as we are working here, I have less chances to have ovulation, so I have less chances to perform my embryo flush and to recover embryo. The stress, mares that are under stress can have a higher cortisol levels that can be a potential cause of ovulation failures. Also, if this stress is too intense or too sudden, then we can face embryonic death, early embryonic death, because of the stress. Also, we will see a lower recovery rate for mares that are going under stress, and also these embryos will be less viable after the embryo transfer. The body condition score. Well, body condition is an important indicator of health, fertility, and the reproductive efficiency of the mares. Here, in a scale between 1 to 9, when the mares had a body condition score with 4 or less, they had a reduction around 20% in the pregnancy rate when compared with the mares with more than 5 in the scale, in the body condition score of 5 in the scale between 1 to 9. So this is something important that for that donors that are too skinny, we have to explain to the owners that sometimes we will not be able to recover embryo until these mares get in a better body condition. If the mares are going through some prolonged anti-inflammatory treatment, for example, as dexamethasone, it can result in the inhibition of LH secretion and, again, ovulation failure. So this is important also for the mares that are in competition or the mares that had any bonus problems, because then usually they will be under anti-inflammatory treatments for a long period of time. The exercise, it may have an influence in the embryo recovery. As we can see here, they had 2 groups, the mares that were not exercised and the mares that were going through some exercise. And the embryo recovery, it was higher in the mares that were not doing exercises, 63%, and almost half of 34% only of embryo recovery in the mares under exercise period. The grade of this embryo, the quality of this embryo, they had a much higher grade 1 embryos in the non-exercise mares, And only 36% of the embryos were classified at grade 1 in the exercise group. And when the embryo were grade 4, that is a very low quality, they had only 14% of grade 4 embryos in the group of non-exercised mares, and 36% of grade 4 quality embryos in the exercised group. In this other one, they had the three groups: the control, mares that were not doing anything, the partial exercise, and the full exercise group of mares. And again, the embryo recovery were much higher in the control group when compared with the mares undergoing exercise treatments. And the grade of these embryos, also the quality, they had a much higher grade 1 in the control group when compared with the exercise groups, 55% in the partial and 78% in the full exercise groups. However, in this other paper, they had two groups of mares, the breeding mares, and also the training mares, that the mares that were athletic mares that were undergoing in intense training for the competitions. And they couldn't find any difference in the embryo recovery, neither in the pregnancy rates of these embryos in the recipients. Here, they think that they didn't have any effect of the training because they were mares under training for a long period of time. So they were used to this routine of training. And they think that when we start a new program of exercise for the mares, this change in the routine is the one affecting the embryo recovery and not the training itself. So it's the stress of a new routine. So if this mare become well used to this new routine, then we will have a difference between the embryo recovery of these mares that were in a routine without doing exercise, and in these mares that just start this new routine of exercise. So the take-home message to you is that embryo transfer program, it is a program with multi aspects. It is a puzzle that we have to pay attention to each piece. Otherwise, we will miss something that will have a huge influence in our embryo recovery and also in our embryo pregnancy in the recipients. So it was that for today. Let me stop the sharing.
Thank you, Dr. Maria. Such an insightful session about today.
Most welcome.
If anyone has question, he can ask directly or can send in the chat box as well. Dr. Maria, someone sent a message in the chat box. You can.
Okay, let me see. All right. Let me see here. Here the question. Okay. What are the risks of uterine contamination during the flush procedure? Let's start with this one. If I said if we are not doing a proper cleaning of the perineum, then we can increase the chances of having a uterine infection. So we must be very careful during this. A lot of people might think that is not so important, but it is. So, and also if you can use a sterile glove, for example, to do the flush, it's better because then you avoid the contamination that can be coming from your glove. We know that they are clean, but if they are sterile, it is better. So the vagina has bacteria, commensal bacteria. So we must protect a lot the tip of the flush catheter as well to not become in contact with all these commensal bacteria that are in the vagina, but they are commensal bacteria for the vagina, not for the uterus. So always protect very well the tip of the flush catheter to avoid carrying contamination inside. So I don't have a percentage to tell you about the contamination. But if you take care of the cleaning of the tip and wear a sterile glove, for sure it will be much lower risk of getting your donor contaminated. And the most common antibiotics in my routine, if I cannot do the culture and the sensitivity, the antibiogram, I would go for gentamicin because usually the contaminations are from streptococcus. So we can use the gentamicin quite well to solve these issues. Um, yeah, sometimes enrofloxacin, not intrauterine, okay? All of them are IV, systemic treatments. So, but the best way is always do the culture and the antibiogram. If not possible, I will go for gentamicin. Uh, Let me see the other ones.
Dr. Adiasnan has raised the hand, so please ask.
Hmm? Yeah, here. What are the common causes? If someone want to do a question, please go ahead. I saw here one guy with
Thank
a
you so much. First of all, I really thank you for very outstanding presentation covering a lot of aspect, including male and female. That was really outstanding presentation. So I
thank
have
you.
a
Thank
two
you.
questions. Maybe they are not related. So the perineal region conformation is very important for the reproductive health of
Yeah.
mares, especially. So, do you think, if the mare has some problem with the perineal region conformation, so she could be used as a donor instead of recipient? So we can use, or you think it would not be a good donor as well?
No,
So,
yes, we can. If they have a bad perineal conformation, we can change the categories of the mare. The categories of the mare, like so, if she was for pregnancy, now she'll be for embryo transfer. But if it's really bad and a lot of feces are going inside, or if she has a urine pooling, then it will make the embryo recover also a problem. It will be lowered as well because then it's a very bad situation. But if it's not too much, we can use them as a donor for sure.
yeah, sounds great. So, I'm sorry, I'm asking another question, which is different one. Thank you, I appreciate. So, the evolutionary perspectives, one of your study, you mentioned that the training or the training stress doesn't affect the pregnancy or the reproduction in mares, right? So, do you think it is an evolutionary perspective that the mayor don't get that thing, or it is something else that making them more resistant to those stress, especially the training?
Yeah, I think for sure it is an individual related thing as well. So we will have individuals that they are very sensitive to any kind of stress, to any kind of changes in the routine. So I had the mares here at the farm that if they are under stress, even just changing their box, they will stop cycling. They will make more hemorrhagic follicles. So there is, I will not say a breed related stress, but an individual related stress. And as I said, the changes in the routine. I think this is the most important. So if this marriage is like for 1 year in an intense training, and then we start flushing and everything, I think she would do great because she's in that routine for a year. But
Gotcha.
if they are like if they are leaving a lot for competitions, like every month they are in a different place, staying 1 week for the competitions outside of the farms, then I think we will see a much lower embryo recover in mares like this that we are changing all the time.
Gotcha. Yeah. Thank you so much. I
Most
would like to take this opportunity to thank you again on the behalf of UAS Lahore. I am a faculty in the department. It's really honored to have you sparing your time, putting your efforts in the presentation. It was a very nice presentation.
Yeah,
I
it
thank
was
you.
an honor
I
for me to be
Yeah,
here.
yeah. Thank you.
You're welcome. Here I saw another hand. So then I don't know which you prefer, if I go to the chat or if I go here, as you wish.
Thank you, Dr. Maria. I have one question. As there are many factors influencing the recovery rate, like seasonality, age, is there any influence of flushing media on recovery rate?
Well, I just know one study that I performed with two different medias, with the flush media, that is the proper media to do the flush, and with a kind of Hinger lactate, that usually is the one that we use daily to do the flushes. And in this specific study, they didn't find any difference in the recovery rate and neither in the pregnancy rate in the recipients. So, but I just know this study. Maybe if someone know another one, um, we can see if there are or not a difference. But so far, there's not. There's not.
Thank you. I have one question. Is there any specific time when we know that ovulation time in males? Then what would be the best time for the collection of embryo in male? It's either day 6, 7, or 8. If we know the ovulation time.
Yeah. The if you exactly know the ovulation time, like you know
Yeah.
that your male ovulated today between 2 and 6 p.m. I will say that the best is wait until she is near to day 8, because of it, sometimes, as I said, they might have some delay in the embryo to come inside the uterus. So when we are flushing on day 8, if the embryo is there, it will be there.
Thank you for wonderful presentation.
Most welcome. Okay, so I will go back to the chat. What are the causes of sperm motility? Motility can be related to the kind of extender we are using. If this extender is the best one for the stallion, we know that they have individual preferences. So not the same extender will be good for all the stallions. Uh, if they have some infection in the in the semen, uh, then the bacteria will release a lot of reactive oxygen species that will kill the sperm much faster. Low motility also can be related to the concentration. If the concentration is too high and we don't dilute the semen properly, they will die much faster as well. Uh, okay, the factor for the fertility of a frozen versus fresh semen. The procedure of the freezing procedure, it's very tough for the equine sperm cell. So when we are dropping the temperature, we can damage the sperm cell because they have water inside. So when the temperature is decreasing, sometimes some crystals can be formed inside or outside the sperm and can kill the sperm, damage the membrane, and then they will die. So the as I said, it's much more related to the procedure to be more fertile, the sperm, the frozen semen, because then the quality is good. And also, again, of the stallion, then we have to adjust the dose, because they said, oh, this stallion is not so fertile if I use 5 straws, but if I use 8, then I can achieve a very nice pregnancy rates or embryo recover. So it's totally related to the quality of the freezing, and also the amount of sperm that we have to use for each stallion. It is different. For some stallions, we can use 100 millions, 200, but for some ones, we have to use 5 or maybe 600 millions to have the same pregnancy rates around the 78 or 80% as in the fresh. So it's really related to, again, procedure and the individual doses. And what nutritional factors can improve stallion semen quality? This is hard. Okay, I am not the most expert person to talk about nutrition. Of course, again, body condition, it will influence the fertility of the mare and also the fertility of the stallion, the quality of the semen. If the stallion is skinny, then we will see a lot of defects in the morphology of the semen. But as we have the testicular barrier, there we cannot study properly like which kind of supplements, for example, that we can give it to the stallion that will really affect the sperm cell, that it will like have a good effect in the sperm cell. So about it, I will not be very experienced to give you this answer about the supplements, but and the nutrition, but that's it. We cannot be sure about the things that are exactly affecting the sperm cell in a good way. The common contaminants found in semen samples. If we are talking about semen collection, we will see skin cells, mostly if we don't clean the semen the penis properly. And if the stallion introduces the penis a lot of times in the artificial vagina, so then we will see skin cells contamination. And eventually we will see some bacteria. But then I don't have the data to say to you which ones are the common ones, the bacteria that are the most common ones. What supportive treatments improve uterine condition before transfer? Well, then we are talking about recipient mares. Then we have a huge discussion here regarding recipient mares. But supportive treatments for them is just in case they need. For example, if the uterine tonus of the mares are not so good, if we are dealing with cycling recipients, okay? So if then we can give a progesterone, for example, if her CL is not very active, is not very bright, or if we have the Doppler, the blood flow is not so good, we can use also progesterone. But like a supportive treatment, it's really related to how it is that recipient that you want to use prior to the embryo transfer. So my advice is check all the recipients that you have to use for the day of the embryo transfer at least one day before, and see what you can adjust. If they have some edema, you can also use anti-inflammatory as dexamethasone, for example. But it's really related to how it is that recipient that moment. Here, what is your experience of a success of embryo transfer in Arab region? You are really related to season. Talking about embryo recover, here it's lower. Is the lowest embryo recover that I have between Brazil and also China. We were recover much more embryos during the summertime, during the physiological breeding season there. Then I recover here, and I see a huge effect of the winter time, like now between December and until mid of February, our recovery rates are lower than in the other, like October, November, and then March, April, and May. So I see a very huge difference at this period of time working here. But regarding the pregnancy rates after you recover the embryo, then no, then it's the similar. It's similar. I don't see any difference. What methods are used to synchronize Okay, again, talking about recipients. Well, we can use a cycling recipients that we will synchronize the ovulation between the donor and the recipient mare using induction of ovulation, also prostaglandin. But related prostaglandin, again, we'll see a difference when the cycle of these mares are too short in the pregnancy rate. So we must pay attention to these to lead them to keep them for a while during estradiol phase. So we must these mares must have at least 3-4 days of edema before go to the progesterone effect. And if we are using a cyclic recipient, an estrus transitional ones, then we will use the protocols using estradiol and progesterone. I use here estradiol progesterone longer acting, but there are a lot of different publications about it using or estradiol cypionate 17 beta or progesterone short acting, or even is the short acting but the oral one also. So you can have results using all of them, but again, it's really important the exposure to the estradiol. So you must keep these acyclic mares also at least 3 or 4 days of estradiol, and then go for the progesterone. Um, what reproductive pathologies can disqualify a mare for saving as a donor or a recipient? We discussed this a little bit. So bad perineal conformation, for sure, as a recipient, not okay. For donor, she can still stay in the program. If this mare has any cervical related issues, fibrosis, or any kind of damage, sometimes because of the Foley, for recipient, for sure, cannot be used. For donor, it will depend in how severe is the lesion in the cervix. For recipients, it's really bad if this MERS had a lot of cysts, uterine cysts, so we cannot use. For donor MERS, not a big issue. We can still using them. We see this more in a little bit older mares, the cysts, because the uterus start to have some fibrosis. Um, what else? Of course, any kind of systemic issues for recipients, not okay. Laminitis, fractures in the bones, metabolic disease, any kind of this for recipients, for sure not. For donor mares, it's better for them if they don't carry a baby and they have like a laminitis or fractures or any kind of leg diseases. So then it's better for them to become a donor mare and not to carry the baby. Uh, okay, could you please explain again why using high semen volume such as 200 ml is associated? Okay, is associated with the reduced in the success rates. Is because when we are using a lot of volume or even a lot of quantity of sperm, it's harder for this mare to get clean after the insemination. So if we put just 10 mLs, most of this the mare will the uterus, it will be easy to the uterus to clean itself about what it's not using. So it will use some amount of sperm, and then the rest of the fluid, it will become out very easily. When we are using 200 mLs, it's a huge volume to this uterus to contract and to put all this fluid out. So mostly for mares that are a little bit more susceptible to endometritis, to uterine inflammation, for that older mares, for mares that had already had a lot of babies. So the uterus usually it will be a little bit heavy and a little bit down. So it's harder for this uterus to contract all the uterus and to expel all the fluid from inside. So it's much better when we can use a low volume You can centrifugate the semen if it's a dose that we are receiving from outside and they send, for example, 40 mLs. You can just centrifuge and then resuspend in 15 mLs. It's more than enough. How does uterine health influence in donor mare fertility? How often can a donor mare be flushed in a breeding season? Um, the uterine health has a huge influence in the fertility of the mare. As I said, if she has any kind of infection, endometritis associated or not with contamination, like a bacterial or fungal contamination, it will have a huge impact in the recovery rate. Not too much if she has cysts, as I said, with the cysts for the embryo recovery, it's not so bad. Uh, and also, if this mare has endometritis, it can affect the embryo itself, and then we will have a lower pregnancy rate in the recipient. How often can we flush a mare? It's hard to say. Uh, Here, I already flushed the mares maybe 5 times in one season. In China, I had one donor mare that I flushed maybe 8 or 10 times, and she did very well. In Brazil, usually I will flush 5 times each donor, so they do well if you take care in your procedure. Take care while going through the cervix to not hurt the cervix. Otherwise, soon this male will have a damage in the cervix, and then you will start to facing a lot of problems. Take care, as I said, to do a very clean procedure. Avoid putting anything inside the uterus that is not the media that you use to flush, because otherwise we can create a very messy situation for ourselves, like for ourselves. If we don't take care of this donor during the season, she'll be a problem heir, a problem donor in the next season. How are common post transfer? What are common post transfer complications? Uh, I think just a contamination. If you don't do a clean procedure, or if, as I said, if your donor mare has a uterine infection, inflammation, maybe this embryo, if you don't clean properly, it can carry a contamination to the recipient. So the most common is contamination, but if you take care of every step, it's very low. What is the recommended volume of a flush solution per procedure? This is a very nice question. All of them were very nice, but this is very interesting because we don't have a fixed volume. Like it depends in the size of the uterus of the mare. So usually for younger mares that are the first season, maybe less than 1 liter, it will be enough for each flush. Like the flushes, how we do is usually 3 to 4 times. The uterus has to be full and has to be empty. So sometimes with less than 1 liter, it will be enough for this uterus to be full. For older mares, usually 1.5 liter, 2 liters. I worked in China with Friesland mares, the black ones that are very big, and for that ones, usually I had to use 2.5 liters to have the uterus completely full. So it's really it's really related to the size of the uterus. Because of this, as I said, we have to check the uterus by transrectal palpation while we are doing the flush. Then we know, okay, now this uterus is full. It's time to get it empty. Uh, are there externship opportunities in equine transfer for students? For yes, just if you have experience like a with transrectal palpation, uh, it's fine. You can do internship here. And well, any other questions? I'm more than happy.
If anyone has a question, he can ask. Otherwise, we have to end this session. Anyone, please?
I saw here just another question about where can get a practical experience in equine embryo transfer. Usually at the stud farms, like with anyone that usually we are very open to receive interns to work with us and to learn. So in any place that they have equine embryo transfer, you can get experience like here or um in Saudi Arabia. They also have a lot of farms for equine, so also there. So if anyone wants to, here in UAE, well, we have a lot of people working in with equine embryo transfer here. So if you want to, you can contact me privately. Then we can discuss some places here to for you to stay and doing some internship and check with some vets. Dr. Muhammad, he has my contact, so then you can contact him and we can discuss about it.
Thank you, Dr. Maria, for such a insightful presentation. You really well discussed about the critical parameters impacting embryo recovery rate in male. Okay,
It
once
was my
again,
pleasure. It was an honor to be here.
okay. Thank you everyone for joining this session.
Thank you, Dr. Mohammed Akib. I think we are close to the end, correct?
Yes, sir.
Okay. May I take the opportunity to thank Dr. Maria? I would like to explain this is the small group, the Thirio Graduate Club. So, Muhammad Akib, I appreciate for contacting Dr. Maria, and I really appreciate you graciously accepted that invite and you put together a very nice presentation, your time and efforts. That's really matter a lot to us. I also appreciate the organizer of the TGC, Akib, for this wonderful 1 hour seminar. Uh, uh, it's really 2 to 3 years before we started this club,
Oh,
and I
that's amazing.
yeah, and I also like to mention that I completed my PhD from University of Florida, but I'm a dairy guy, not but still work on the equine in at the clinics. I My supervisor was Dr. Jose Santos. I don't know if you heard his
Yeah,
name.
I heard about
He's
it.
also
Huh?
dairy. Yeah, he's basically from Brazil. So in that connection, I thankful that you taught us a very nice presentation, very nice work that you are doing. I really appreciate, and also I appreciate that you are open. You like the one of the student asked about the externship. I really appreciate if you could help that guy, and it would be very nice connection. I really
Yes,
appreciate.
for sure, for sure. It's my
Yeah.
pleasure. It was wonderful to be invited to be here today. And regarding the externships, as I said, the Dr. Muhammad, he has my contact, so we can chat and see what is the best way to do it.
Yeah, sounds great. Sounds great. I really appreciate. I think that what I wanted to say, and especially thank you.
Most welcome. I saw here someone raise the hand. Okay.
Muhammad Akib, would you like to ask something? And I think then we close the session.
Yes, sir.
I
We
have
are now open.
one sir, one question.
Muhammad, I can ask a question.
Okay.
Yeah, I am Larbi from Morocco. I am professor in university and I am working on small animal reproduction. But actually, I would like, first of all, I have been late because I have a class. I want to see all the presentation, but I just arrived in the end. Actually, I
Okay.
am working on Actually, I am working on horse. I have two PhD students that working on semen freezing, semen cryopreservation, and artificial insemination. And for that reason, I would like to collaborate in next year to maybe send my students, if that's possible, to send my students to your laboratory, and we can collaborate if you have that.
Yes, yes, for sure. As I said, contact me in the private, then we can discuss. I just here I don't working in a very fancy farm. My lab it's very simple, but for sure, we are most welcome to people here.
Okay, thanks a lot. Thanks a lot. Thanks a lot. Thanks a lot also, Dr. Mohammed. Thanks for the session like that. Okay, thanks.
Thank you so much, Dr. Maria, once again.
Most welcome.
Now
It
we
was
can
a pleasure.
close the now we can close the session.
Okay. Bye.
Okay.
Thanks.